Hello, everyone, and welcome to another edition of Contagion. My name is John Parkinson, and I'm the senior editor. Joining us today is Dr. Medha Munshi, who is director of the Jocelyn Geriatric Diabetes Programs at Beth Israel Deaconess Medical Center and associate professor of medicine at the Harvard Medical School. Thank you, doctor, for being able to join us today.
Well, thank you for having me.
Absolutely. Let's jump right into the topic. For those not familiar with your JAMA paper, can you provide an overview of it and your conclusions?
Sure. So as we went into this pandemic and we started we moved over completely to the telehealth and the way of delivering the medicine in general changed. We started seeing a lot of articles and even as the pandemic settled in and the whole medicine delivery went to telehealth, we started seeing a lot of literature on all these difficulties that patients were having with the diabetes care, and on the other side, the clinicians that were struggling. And we realized that in our geriatric diabetes clinic, there are a lot of things that we do that, some of these practical pointers that might be helpful to both the clinicians as well as the patients. So basically the article talks about the strategy that we apply to the care of older adults with diabetes in our clinic. And we point out some of the it's not a rocket science, but the common sense strategies that can probably improve the care during this difficult time.
Within your article, you identify older diabetes patients who have particular challenges during the pandemic. Can you offer a glimpse of what those challenges are?
Yeah, so again, as I said, that the challenges of older adults with diabetes that are happening right now, they are across the spectrum, right? All the patients are having similar issues. But think about it this way, that this is not unique actually on an individual way, that when you see an older adult, an 80 or 90-year-old patient, at different times in their lifetime, they do go through some of these challenges where they are isolated, where they are having difficulty with caregivers, where they are having difficulty with competing comorbidities. So we actually understand that there are clinical barriers, there are psychosocial challenges, and then there are financial barriers. These are all part of what older adults are facing in care of any chronic disease. And so if you think about the clinical side of it, having competing comorbidities, and by that what I mean is that somebody is taking care of their diabetes, but if they have stroke or if they have pneumonia, then those are going to take precedence over how they manage their diabetes. The diabetes, so to say, needs to go on the back burner so they can take care of the acute event first. And so those things happen with any kind of acute problems. The medications management or the access to care, and that was the big problem we saw, that can I have my labs done? Can I come and see their physicians? Can I have the other imaging done? Those can become the challenges. And then monitoring, how many times we monitor, how much diet, their diet therapy that they are on, or their habits, how many of them they can maintain, or can they do the exercise the way they used to when the senior centers are closed, the gyms are closed, and they are not supposed to go out. So those are the clinical challenges. Then the psychosocial challenges are isolation. They can't see the families. The caregivers, a lot of them depend on the caregivers, whether they are family caregivers or they are the formal caregivers, so, physical therapists, visiting nurses, aides, they all stopped. So how do we manage with that? And then the isolation leads to the depression and anxiety. So those are the psychosocial, and then the financial, whether they are able to access the things that they have dependent upon. So those are the common challenges that we talk about in the in the paper.
Absolutely. And being that they are having a lot of challenges that wouldn't be expected in today's society, I guess one of the good parts of having the technologies we have is really probably helped quite a bit. And during the pandemic, doctor, what would you say have been the best technologies that have helped clinicians continue patient care?
Yeah, so overall, and in fact, I also talked with my my colleagues who take care of the younger adults. So I don't want to completely skew towards the patient population that I see. But the continuous glucose monitoring has been the best technology that has been really a great asset, especially during this time where the patient doesn't have to physically bring their finger stick numbers, especially the patients who have type 1 diabetes or who are on multiple insulin injections a day, and they have to check their finger stick several times a day. That can be uploaded to the cloud, and that can go to the physician. It also gives sort of a average glucose, sort of a hemoglobin A1C based on the 2 weeks or so of that continuous glucose monitoring. So that has been overall a really good technology that we have come to appreciate. The telehealth per se has been really helpful because a lot of times in people with diabetes, especially the ones that I see, the older adults, the whole process of trying to come from home to the clinic and getting somebody to bring them there, and it becomes a chore. It's a whole day process, and the telehealth has suddenly become mainstream because of this pandemic, and more platforms are being developed. And that has helped to keep more in close contact. When the things are not going well, if they have to come to the clinic, it's hard for them to come in every 2 weeks or every month. We can do much better care when we can do this contact with the telehealth. Yeah.
Yeah, absolutely. And in looking at, things like telehealth and being able to use continuous glucose monitoring and using your phones to be able to upload the data and so that the doctors are able to see that, is there anything conversely that you find with the older population is challenged when using specific types of technology?
So there are two types of older population. One is who are technology naive, who are hanging on to their wall phones, right? So and for them it has been a much more difficult times because they understand that they could do better if they did a little bit more in technology, but it's hard to teach them from far away. And then there are more technology users, and as the baby boomers are turning into the older adults, they are a lot more efficient with how they use technology, and with them it has been really much better. There is still a lot of glitches like this, the access to the Wi-Fi, they may or may not have it, and if they have it, it may not be strong enough to carry on communications, and that becomes very frustrating for them. Even though the data upload and the cloud-based technology has been really well developed, it still requires quite a bit of steps in between. And so for them to learn that and get to a point where it's uploaded. I mean, I would say that in my clinic with the geriatric diabetes clinic, probably half of the patients, they try to upload even glucometers to the on the platform, and it's really frustrating, and they feel like they're failing, and so I think technology can become better. easier to use. I think we do need to have this technology become more age friendly. But it's much better than what it was before. And it depends on where they are coming from, whether they have been using technology and now they are just needing to use a little more, or they are just one of those who are just new to technology use.